we focus on improving maternal and child health services in the villages. We are working now in 60 villages in 3 districts in one of the eastern province in Indonesia. We use an approach called citizen voice and action to improve the accountability of the basic services conducted by government for the people and communities in the villages. For the poor people in the villages, in the rural areas, for them it's not really easy to get a quality basic service. In many cases, it's very hard, difficult for them to get the qualified basic services. And because of the education background, the economic background, social background, it's also hard for them, difficult for them to speak up whenever they face these problems. They cannot express their thoughts, their feelings about the basic service provided for them. So the idea is how to engage them, to provide space, to facilitate so the people, the community, the citizens in the villages, especially the disadvantaged people, they have the safe space and also opportunity to speak up, to tell about their feelings, their thoughts about the basic services provided for them. And once they have this kind of opportunity, the spaces, then when they can express it, it creates it makes different between in what happened in the community. It can improve the basic services that provided for them. I have like example, for instance, yeah, even when a midwife can smile when she provides service to the pregnant mothers, for instance, it makes quite big difference to the pregnant mothers. If the pregnant mothers come to the service, health service, and the midwife doesn't smile at all, get angry to the pregnant mothers, for instance, then the next month, the pregnant mothers wouldn't come anymore. And in turn, it will impact also the mothers, the health of the mothers, and it will also impact the health of the babies also. I think speaking about poverty reduction and sustainability, in many cases we merely look at the physical and material poverty dimension. We are not talking, or we are rarely looking at the relational dimension of poverty. When we can bridge the community and the service providers and the government, or also with the private sectors in a constructive dialogue, then we can improve service, we can improve better relation, we can improve better understanding between different stakeholders toward the benefit of the community, also the government, the service provider, and also the private sectors.